why do you feel everybody should go for a full body check? For me, I actually feel it's, head to toe assessment. That's what we nurses know it as. You go to the hospital, do a full head to toe assessment from physical assessment to observation and all of that. But I really want you to shed more in-depth light to it. What do you feel a full body check is, and how often should it be done? And is it based on age, gender, race, or any of that?
Okay, so a full body check for the doctor starts the moment you walk into the consulting room. There are things that the doctor will pick up, even with your gait, your expression. There are some things that the doctor can pick up from there. And then we'll take a detailed history, because everybody is different.
Yeah, sure.
Your religion might affect some things, your sex would affect some things, your occupation, whether you are married or you're single, whether you are the first child or whatever position you are, all those things we need to ask. That will give us a good picture of the person we are dealing with. And then from there, we move on to examination, general examination of the patient. Yes, I mean, that's one you can call the head to toe, because in a good examination, you actually do that. And then from the history you have taken, you also be able to know which system you need to focus more on.
Yeah.
Although you try to make sure that you do a full examination of all the systems. And then after you've done the examination, you'll be able to come up with a diagnosis. Is this person healthy? Are there issues that need to be tackled? From there, you now move on to investigations. So you'll be able to know which investigations you need to do. There are some investigations we call general investigations, like the blood checks.
Okay.
Do a full blood count. That tells us about your level of your blood levels, and we can also from there check if there's any infection, anything suggesting infection. Then we can do electrolytes and urea. Those tests will also give us a pointer to how the organs are functioning.
Yeah.
And if everything at that level is okay, you might not need to do any other major investigations. Okay, of course, you can also do the urinalysis. Yes, check the urine. From the urine too, we can also pick things, do the blood sugar tests. So if everything is fine at that level, you might just